Ooh, and there I am. Hello, everybody. Thank you for joining us today. In order to make this work a little smoother, I'm going to turn my video off. Sorry. There we go. So, Wounds Canada is known for caring for the wounded, and that's what we are going to do today. So welcome to all of you, healthcare professionals from across Canada and beyond. Yes, we have a few international visitors today. This will be our three-part session on COVID-19 pandemic, caring for the caregivers. And I'm moving a slide. There we go. Jackie and I are your hosts or moderators from Wounds Canada. Jackie, can you show yourself?
Hello, everyone.
So as I mentioned, have we been here before? A few of us, much younger selves, for HIV and AIDS. Some of us for SARS. Most of us for H1N1. But we haven't been here before when it comes to COVID. It's 10 times deadlier than H1N1 and has a quicker transmission rate person to person. So we know that we in Canada, along with the rest of the world, are experiencing an unprecedented event, a COVID-19 pandemic. So Wounds Canada, as a response to the wounded, which is our healthcare professionals, have developed a three-part series. And here's our objectives. So number one, we're going to discover and clarify the issues related to your experience. So this isn't something you see on TV. This is your experience today. And then on Thursday, we're going to discuss the issues that we identified today with our expert panel. Now, we have some experts on today, but we're going to have even more on session 2 and even more in session 3, where we develop or identify strategies with that expert panel to help you move forward as you live with the reality of the COVID pandemic. We'll also have open forum on session 3 as well for Q&A. So how do we build strategies? That's the goal of this, is for you to come away. You know, I used to be the queen of process, and then I said, wait, the queen of product. What did we make? So how do we get to that strategy? Well, Dr. Keith Harding says it's not the answers you get, it's the questions you ask. So today, that's what we're going to focus on. We want to make sure we've got the right questions that we can bring to our expert panel on Thursday. And also, we want to get to the heart of the matter. Where's the beef? Like, what is really the biggest concerns that you have? You know, a lot of people are asking a lot of questions. We want to zero it down and find out what you really need to talk about. And then we can start to identify and create strategies. Some of you probably have lots of strategies that you can share. And we're going to have, again, another group, an expanded group of panelists on that third session. We'll also talk about who do you need to make it work. No one's an island. And one thing we're learning the past month is that we need to do this together. No one person can stop this virus. And then because it's such an unpredictable reality, you need to be able to review your strategies on a regular basis. So it's not easy. Here's our format. Today, we're going to poll the questions. We have 4 categories we're going to use: clinical practice, your professional practice, your own personal practice, your personal life, and your family life. It's holistic. That's who we are. We're healthcare professionals. And you get to select all that apply. So we're going to give you a lot of distractors to look at. Then we're going to review and clarify, and that's why we have this the experts with us today. They're going to make sure we're spot on with our questions. Now we have other. So we can't assume that we know what all the questions are. So be prepared to share with us if you choose other. There'll be a question pane, or you can raise your hand. And then finally today, we'll be able to zero down on key concerns. You actually have to select one that impacts you the most. That's the hard part. So we're going to use polling. And so we'll be on this mode for session 1, but we'll be moving to Zoom for session 2 and 3 so we can see everybody's lovely faces. We need feedback and participation. This is all being recorded, so you can submit additional questions and comments online. You need to keep your phone or computer audio on mute or we get really bad feedback. Type your other response into the question pane or the control panel, on the control panel, or raise your hand to speak. Don't use chat, okay? And participate. What we're going to create over the next week is this pandemic model that was adapted from Ian Henschke. And as you can see today, there's all sorts of things that we want to discover. There'll be fewer to discuss, and there'll be some darn good strategies in section 3, which is develop. Gotta love process, people. So here's our experts today. All right, who do we have? Now, a lot of you are familiar with Janet Kunke, who recently got her doctorate. She's well known in the wound care community and is particularly interested in the assessment and treatment of clients, families, and caregivers using a holistic psychological, spiritual, emotional, and physical care approach. She asks, how can we support each other during these challenging times? And our second panelist is Noha George. She's been practicing in Ontario for the past 25 years with not-for-profit sectors, inpatient hospital rehab, and the private sector, journeying with individuals, couples, and families who have experienced trauma, and the ultimate goal of facilitating hope and healing and planting new beginnings. And Noha also works with a holistic approach, considering mind, body, and spirit. So welcome, both of you today. So shall we move on to our first question? Oh, I can hear the excitement. Here's your first question. I will read the question and then it'll go into a polling mode, which Miss Elena will do for us. How has the COVID pandemic impacted you? Most of my patients have tested positive for COVID or have COVID-19 symptoms. Some of my patients have tested positive or have COVID symptoms. Most of my patients are high risk, but no COVID or COVID symptoms. I have no current patients with COVID-19 or COVID symptoms. I am concerned that anyone around me have COVID-19. Now remember, okay, so some of my patients have tested, 9%. There was 0 with most of my patients. So I'm assuming we have, I shouldn't assume, it suggests we have no ICU people here, ICU people that have COVID. 9% have tested. Most of my patients are high risk. That's 38. That's our largest group. 27% said I have no current patients, and 27% said I'm concerned that anyone around me may have COVID. So any comments from my panel?
So this is Noha. I guess one question that I have is for those that are concerned that anyone around me, would that include primarily in the community or in the work setting?
Yeah, that's a good point. That's a good point. Again, the assumption is it's anyone around me, no matter where you are, shopping center or wherever. But 38% said high risk with no COVID. I know from our demographics, we have a lot of long-term care and community care, which would put that patient population in the high risk category. Okay, let's move on to the next question. And these are all recorded. Okay, next question. Go. How has COVID affected your clinical practice? All right, pick all that you think you need. I'm concerned about a safe work environment, PPEs, safe patient loads like staffing, good basic care, feeding, providing nutrition, incontinence, wound care, physical and emotional impact of isolating patients, or other. All right, let's open the polls, Elena.
The poll is now open.
Okay, pick your poison, people. Which one affects your clinical practice, do you feel? Remember, once we find out what the main concerns are, these will all go to our panel next week for discussion. or on Thursday, excuse me.
Concerned about a safe work environment, PPEs, that is 68%. I'm
Whoa.
concerned about safe patient load, staffing, 44%. I'm concerned about the ability to give good basic care, 49%. I'm concerned about the emotional impact of isolating patients, 66%. So we essentially, they're high. We have, and we did allow multiple answers here, but we've got a pretty well a tie and concerned about safe work environment and emotional impact of isolating patients.
Mm-hmm.
And there's 20% that have commented there is other.
Okay. Can we get some feedback on the other? Now you can use, put your hand up and we'll release the microphone, or you can type into the question box. So give me some examples of what the other are. So we obviously have two very strong issues here. Okay, anybody responding?
Thank you very much for including me. I'm an independent practitioner and I have my own foot care business, and it has been recommended that we do not go in. So at this time, it's affected my clinical practice. It's completely eradicated it.
Oh, that's huge, isn't it? It's not just your it's your clinical practice, but it's also your patients.
Well, yes, because at this point, it's been over a month, and I've got people who have diabetes, who have the wounds, and are going to develop a lot of problems. And they haven't deemed, I'm a registered nurse, and they haven't deemed us non-essential or essential. We're in this big, huge gray area, and there's not enough personal protective equipment for the community either. We've either handed over all of ours to a hospital or a long-term care, or we're facing not having enough masks, and it's really hard. So we're losing, like for me, we've lost everything practically, other than the ability to pick up a phone and call and see how they're feeling.
So if we rephrase this, and Janet, weigh in if you wish here, if we rephrase this, so what I'm hearing is that there are some quote unquote essential services that aren't allowed to practice right now. Like foot care is an essential service, but yet you can't go into patients' homes or have them come into your clinic. Is that what you're saying, Amanda?
That's correct. Nobody has told us we can't, but nobody has told us we can. Like they've told us social distancing, and there is no that we need to stay home, and that the patients need to stay home as well. So I don't have a clinic. I'm mobile, and all of the retirement homes that I'm in have kind of shut down in that area because they've had to keep everybody kind of just in their own little bubble.
Okay, and that's a very good concern. Does any of the panel want to clarify anything, or are we good with that?
It's Janet. That's a really great point, because there hasn't been clear communication, Heather, for the nurses in those roles.
Yeah. And that's a big part out there, especially, I know VON was doing a lot with them, and a lot of the Bayshore, a lot of different agencies provide that service. Is there anyone else who has an other that they'd like to share?
Hi there, it's Tracy. Can you hear me okay?
Yes.
Thank you very much for hosting this talk and pulling all clinical, I guess, all different avenues of clinical together during this COVID-19. So my current role, being a registered nurse working in the acute hospital center for probably close to 16 years, I've left that role and I now support a pharmaceutical company in a clinical role.
Yeah.
And the challenges we are having, of course, is the supply and the demand. And again, long-term care now being our focus and how we can support all of that, but looking at different, I would say really exceptional ways of pulling together options for clients. And I just guess because of my background being hands-on and bedside for so long, I find it extremely challenging. And I find that there has to be more that I can do. So it's a very challenging time for sure.
Mm-hmm.
Okay, we'll bring that forward on Thursday and get some real good feedback on that, Tracy. Thank you for your question. Is
Thank you.
there another question?
As the first caller said, I'm in an independent practice, but I have a clinic. Okay, and when I contacted the Algoma Health Unit, because today a few of my clients had called and asked if I could go in and provide care, because it's coming on to the month and a half. I've been off since March 19th, when the RPNO sent out a notice and requested that we cease because we could not physically and provide the social distancing practices. So I approached the Algoma Health Unit here in the community, and they said that they suggested that I contact the CNO for direction, because it's not clear as to that what we are definitely is deemed essential and non-essential. I do provide home care services, but I have ceased doing home care practices as well, because I want to keep not only myself, but I want to keep my patients, my clients.
Linda,
Yes.
you are demonstrating a very good example of discussion of a problem. Do you have concern?
Yes, I do.
Okay.
I do, because we are deemed, I have clients now that's coming on to a month and a half that have not received care, and I'm worried that some of these clients are going to be going into the emergency department with wounds.
I 100% agree.
And, you know, and we're not even going to have the COVID clients that are going to be maxing out our hospital beds, but we're also going to have them going in and having amputations, high risk of amputations right now for most of the diabetics.
I think we're going to have repercussions from this event for months to come.
Yes.
Okay, let's move on to the next question.
Okay, I just want to clarify something, Heather. We've had a few questions along the same lines, so let's just put this down as not clear on essential and non-essential services. And the concern is that patients are not receiving the care that they needed, and the clinicians are concerned about that. And again, just to reiterate the importance of putting your concerns in the question, it will be captured, so please continue to do that, because we do have a few that are coming in, and we want to ensure that everybody gets their concerns put forward. Thank you.
Exactly. You know, that's why we have 3 hours for this, because it is a big issue. And if we can just clarify the questions, we can move forward on Thursday, because I know you've got a lot of solutions out there. Okay, question 4. How has COVID affected you professionally? I'm concerned about moving out of my role and into another. We know that many nurses and other healthcare providers have been seconded into COVID clinics. I'm concerned about burnout. I'm worried about possible legal, ethical decision making. And I think we've seen that in Italy and Spain. I'm concerned about the future and the course of the virus. We've also seen that in New York, unfortunately. And then, of course, there's the big other. So, Elena?
The poll is now open.
Future and the course is really an unknown for all of us. The legal and ethical ran at 66, which, you know, if this pandemic continues to pick up speed, that may become even a bigger issue. And I was surprised with 53% about being moved out of the role. So that is an actual problem out there, I guess. Any comments or concerns?
We do have 10% who said other, and we do have someone who has a raised hand.
Okay, let's go for it.
Not being able to provide care. So I'm based out of home right now. So I'm not in the office and I'm not able to provide care.
Okay, that's good. It seems like that's one of the bigger issues, even though, what was it last time? What was the percentage last time? Do you remember, Elena?
I don't know.
Okay.
But I think this is probably part of the other is that, you know, the concern of a proper, I don't know, delineation if you are essential or non-essential. So I think this has become quite a common stream. I've got a few questions that relate to that same concern. So we'll definitely put that forward for our next 2 sessions for discussion.
Here's a good one for you. What has most affected you professionally? Most. You get to pick one here. What has most affected you professionally?
It's interesting that 2 times people really do have concerns long term about the effects of the virus.
Yeah, I think we all do. You know, they keep saying the second wave. I think that's what makes us nervous. We've lived through the first quote unquote wave, and now what's the second? And again, I'm looking forward to Ranjani discussing this with us on Thursday. All of these people are on the same meetings every day, and they'll have a lot. She should have a lot to say.
And some of the written concerns, again, are relating around the inability to be able to provide the service, the service that we would generally provide. So either going into a long-term care home to provide the consultation for the clients, having to do that over the telephone, not being able to see the progression or changes that are happening with, for example, wounds. So there seems to be a lot of concern from the healthcare professionals that they're losing touch with their patient and their patient's condition. So this seems to be a big concern in what I'm reading in some of these questions that are coming in.
Yeah.
Good points, Jackie. One of the things to remember is healthcare is a very face-to-face sort of profession. I mean, we deliver care. Laying of the hands is a good example. I mean, we're there, we're looking, we're seeing, we're smelling, we're touching, we're feeling. And now we're being relegated to a screen such as this, or a baby monitor. You know, how you doing on a baby monitor? Yeah. Yeah. Noha, do you have any comments about that aspect of it? The fact that we can't connect with our patients?
I actually do. I think what stands out for me as well, though, is I find again that it's interesting that of all of these factors, I think the one that's creating the most concern, or if we could say perhaps anxiety, is the future in the course of the virus. And interestingly enough, despite the fact that all these other things are scary or unknown to us, I think that the future in course of the virus is the most that we feel unfamiliar with, and it's the most unknown. And this is why it creates the most concern for us, because we're all familiar with the concept of burnout, and although no one would welcome burnout, we're somewhat familiar with what we need to do to avoid it. Ethical, legal decision making. We've all confronted scenarios in our career where we've been faced with dilemmas and we've had to make choices, and we have a sound value system and we know where we would stand, or even if we haven't consciously made certain decisions, we've given thought. But the one thing that we're all sort of stumped about, well, what's going to be the course of this virus? How is it going to play out? And it's that invisible threat that nobody really can capture. And I think that's why it stands out.
It's out of our control, isn't it? It's out of our control.
Absolutely.
Other than stay at home, wash your hands. Okay, question 6.
Yeah.
Now we're getting to the holistic part, because we've got to care for each other, and that's what these next couple questions focus on. How has COVID-19 affected you personally? I'm concerned about the risk to my health. I have trouble sleeping. I'm worried about financial issues and layoffs. That could be yourself. It could be your spouse. It could be your kids. It could be your parents. Who are you going to have to help out? I miss the social engaging and volunteering, such as sports, faith-based activities, or activities with family and friends. And then, of course, the dreaded other. Okay, Elena.
The poll is now open. So I'm concerned about the risk to my health, 56%. I'm having trouble sleeping, 33%. I'm worried about financial issues and layoffs, 55%. I miss
5,
social,
did you say?
5, yes.
Okay.
I miss social engaging and volunteering, 60%, and other comes in at 16%.
Wow. So the biggie is the social, the human part of who we are, the part to engage and to be together with family, friends, etc. Sleeping, I'm surprised sleeping, I mean, that hits me every time I lose sleep. But the risk to the health, 56, that's completely, I think it's completely expected, especially given our profession. And the financial issues were 55. So we had 60 is the number one, with 55 or with health and layoffs as second. Do we have anybody with their hand up about the other?
I don't see any hands up right now, so certainly if someone would like to comment and has an other, please do raise your hand.
I did get a couple with regards to the PPEs, which we will definitely capture that. I did have a question with regards to keeping up with policy changes and procedure changes based on the fast change within the virus itself. So how do we in turn ensure that we are keeping up, I guess, within your facility and your organization with those changes? So I think that's a very good question. And the other question that I haven't seen or common question is, should we be working at one office, or should we be limiting our travel going from office to office or patient to patient or location to location, which again I think is a very good question.
You know, the other agencies and the what was the first thing you said there? Gosh, my brain.
The policies and procedures.
Policies in long-term care is, with long-term care, a lot of them are independent. And I know our government here in BC had just finally said enough is enough. You've got to follow these policies. But, you know, with independent organizations, it's difficult. So that'll be an interesting. So now the tough one, which has affected you most? Which is most? So this shouldn't take you too long, but this'll separate the wheat from the chaff here.
And the poll is now launching.
This certainly hasn't been an easy time for healthcare professionals. I'm hoping that this 3-part series will give you an opportunity to express some of these concerns and to work with some of our professionals. Okay, where are we at, Olena?
We're at 72%, and I'll just give it 2 more seconds, and we're closing the poll.
Okay.
And we're going to share.
The most. Yeah.
So, the most, it's I miss social engaging and volunteering at 31%.
Okay, and it was a good number before. Okay, what are the others? I bet we're split again the same way, eh?
We're kind of split here. I'm concerned about the risk to my health is at 24% and is tied with I'm worried about financial issues and layoffs. And then I'm having trouble sleeping is 14%, and other comes in at 6%.
Okay, so the risk to your health and the financial issues pretty well stayed the same. They were one apart before, and the biggie, of course, is the social aspect. I'm sort of happy to hear that, because that is a big part of who we are as people. Okay, let's go on to the last set. How has COVID-19 affected your family? I'm concerned about infecting my loved ones. I have concerns for the confinement of my family. I am more exposed to interpartner violence or family violence. I know that's a tough topic, but it is the reality according to what we're seeing on TV and the news. I'm worried about childcare resources. And other. Gotta throw in other. Okay, Elena?
And the poll is now open. And the results are, and this is number 1, I'm concerned about infecting my loved one, 77%.
Wow.
I have concerns for the confinement of my family at 58%. I'm more exposed to interpartner or family violence at 2%. I'm worried about childcare resources at 6%, and other comes in at 8%.
Okay. Well, we certainly can recognize the two big ones there. We will still address the inter-partner violence because it is something that people don't want to share, and I think we have a responsibility just to address it in our, briefly, in our discussion. And childcare could be elder care, it could be all sorts of different people that need support in your life, you know. How about the others? Does anybody have, it was only 8%, but let's take a look at what the other could be.
Yeah, so please put your concerns in the question panel, or you can raise your hand as well. I'm just reading some of the responses, and it is predominantly the concern for risk to family and friends and elderly parents as well.
Yeah, good. Okay, no hands up.
No
Okay,
hands.
Heather, I have a question,
Yes.
a very good one.
Okay.
That I do want to mention, and I want everyone to think about this as well. What support can we offer to close family members who have lost loved ones to COVID? We cannot be with them to grieve and have concerns regarding depression, etc. Very good question.
We have the privilege of having Martin Hales with us on next Tuesday in session 3. He's a chiropodist and president of the College of Chiropody in Ontario, and he has just lost a family member. And he also thought that he had COVID until he found out he tested negative. So we will be addressing that. And I can't even imagine, now you're getting me emotional. I'm a little bit, I lost my parents not too long ago, so this is tough for all of us. But yeah, and tough, not just tough not being there, but tough seeing how the dead is being treated when it becomes as big as it is in Italy and other places. We don't want that to happen here. We don't want that.
Yeah.
So,
and there are some others, Heather, that I think are important to consider as well. And it's, you know, around that social isolation, you know, they're concerned about losing the closeness with family and friends. And, you know, just reading on social media and on your Facebook, you know, people were not able to celebrate and share with their family this Easter weekend. And I think it was extremely difficult. You know, I myself, my mother is in a retirement home, and, you know, it's very difficult to have that distance and not be able to see them. You know, we do, you know, Skype and those kinds of things, but I know that there's something missing, and I think these questions that are coming forward now in how we can deal with some of these issues, I think will be very pressing moving forward.
well, and with Janet and Noha both with us tomorrow and on the following in session 3, I know that they'll be providing resources for us as well. And I know, Jackie, you've also talked about online resources that will surely make available to people. I mean, that's the whole thing around this event, is trying to find out what the issues are and provide some support. Okay, here's the tough one. What's affecting your family most? What's affecting your family most? This is the last multiple choice question.
Number 1, I'm concerned about infecting my loved ones at 54%. I have concerns for the confinement of my family at 41%. I'm more exposed to interpartner or family violence at 0%. Well, that's encouraging. I'm worried about childcare resources at 2%, and other comes in at 4%.
What was the first one again? Oh, I guess it was 54, eh?
It was 54. I'm concerned about infecting my loved ones.
Was 54, 54.
Correct.
Okay, good. All right. Any comments, Noha?
Well, it doesn't surprise me. I think that, you know, for most of us, it's one thing to sort of fall ill ourselves and quite another thing at a time when we're witnessing so much suffering to actually bear the thought that we would be the cause of, you know, infection and such suffering for someone else. So
Yeah.
I'm not surprised at that.
Yeah. Okay. Moving forward. You know, Miriam Botros is the director of Wounds Canada, and she said, you know, we've been talking so much about what's hurting us and the fears and the concerns. Can we share something at the end of this that has surprised you in a positive way during COVID-19 pandemic? So now you actually have to put up your hand or write something in, share something with the group that has surprised you in a good way about COVID-19. I'm not saying COVID-19 is good, but is there something positive that's come out of it? So this is wide open to everybody.
And you can enter anything that comes to mind in the question pane. In the meantime, while folks are thinking, I wanted to mention a couple of other concerns and comments that have come through, in that maybe people may not have the full understanding of what is going on and what we are facing with COVID-19, and concerns about teenagers and social isolation and isolating ourselves if we're practicing actively in a facility and we're coming home. What is our concern at that point? Do we, you know, send our kids to their another spouse or to another family member? So the whole aspect of self-isolation, as well as the social distancing and missing that piece with teenagers and children, and, you know, being able to go to the park and being able to see their friends, and maybe not fully understanding why they can't do that. And elderly, again, the same concept. Maybe they have dementia, maybe they have Alzheimer's, and they're not completely understanding why they can't go out of their room, or why their family member or loved one is not coming to visit them.
Yeah. I have two absolutely beautiful granddaughters that are graduating this year. And it breaks my heart that they won't have that experience. You know, I mean, that's small in the big scheme of things, but still, that's a milestone for young girls finishing grade 12. So yeah, there's a lot happening out there that we can talk about. Does nobody have anything positive to share? I mean, one thing you said a minute ago, Jackie, is people don't realize. I think people are standing out there and singing to nurses and doctors and all the other healthcare professionals, paramedics, etc. I think there's a bit of an appreciation going on out there right now. And I see somebody's hand up, Olena.
Yes, we've got Amanda, and Amanda, the floor is yours, please.
I think it's a very positive thing that we're finally getting together as a collective, like as nurses, as caregivers, and we're accessing the things that are available to us, like this podcast, or not podcast, sorry, like this meeting, and so on. And I think it gives us time, well, for me anyway, it gives me time to learn new things, learn more things, and I know I'm home with my boys, so I get to be more present with them, and I'm really grateful for that.
Yeah. And I think the opportunity as well to hear that you're not alone. And back in 2003, I worked during SARS, and I felt a very big difference amongst us as practitioners, that we didn't have that camaraderie that we normally did. It was business at hand, get the task done, do what we need to do, but we just lost that piece. And I think that's extremely important, because that's part of our ability to let down as well. So I think that's you know, a good point. You know, being able to educate ourselves, being able to learn something. I'm reading here again. There's positive things about people making masks. You know,
I switched from building a grad gown to making masks. So
yeah. Yeah. So we've got a lot of things coming in here. Again, on the news, I've seen one of our hospitals here in Ontario, Sunnybrook, a church had gone to the location, to the actual hospital, and they were putting up signs and, you know, hearts and signs and messages. At my mom's home, where she's at, we put signs up on their window, and we also put signs on the window of the office to thank the staff, because that's extremely important. And as I just mentioned, you know, you're in work mode, and it's, you know, you've got your head down and you're going, and the dust is kicking up behind you. But we also have to remember to take that breath and to you know, thank each other and appreciate, and, you know, the clanging of the pots and the pans, and, you know, those kinds of things that come on social media, and people singing, and, you know, all these things, you know, even though it is a positive within a negative, hopefully at some point we can try to lift each other's spirits in some way.
Well,
Jackie, we have another person who would like to share an experience, and it's, go ahead.
Yeah, I guess I just want to say that one of the positives I found in this whole, you know, really horrible situation is that the ability and the time now to give back to the community. Yeah. So I've never really had that time, and now I'm taking, you know, 3 mornings a week to deliver food to people that can't get out or are not allowed to be out. So I'm feeling good about that. So, and my husband's helping at the local food bank.
That's wonderful, Anne. Well, I have a little gift for you all. You know how we started, and I said I wish I could do a wound conference with you because, you know, a day without pus is like a day without sunshine. Well, here we've got something for you that we've had on the back burner for a little while, and we brought it to the front burner because we know that your patients, your residents, and the people you care for, your clients, need to know how to care for their wound at home. So we have a document that's available to you, and I see, Elena, you've put the hyperlink up. You can click on that, and it's a 9-page document, but the first page is sort of the quick reference guide, the how-to, and then each of the numbers you see have a corresponding page that walks your patient how to do that specific procedure. The other good news is, over the next couple weeks, you're going to see one for prevention and management of pressure injuries, and another one for leg edema, and one down the pipe is diabetic foot care as well. So this moved it up in the line, and you can download it. I'm going to pass this over to my colleague here, Jackie, to do the wrap-up.
All right. Well, you know, it's clear from what we've heard this evening. You know, many of you have some valid concerns, and you know, my eyes have just been scrolling up and down. And you know, as I said, we will take each one of these and we will extrapolate them and we will discuss them further. And that's why we have done this 3-part series. Again, you're not alone. You know, our goal tonight was to hear and to listen to those concerns, and then help support you the best that we can as an organization with our expert panels and our panelists. We've got more expert panelists that will be joining us in the next two sessions as well. Now we take, you know, all of these concerns, we will address them, and you know, I want you to consider and think, you know, what you think and feel does matter, and we want to capture that, and at any point, if we haven't captured that, then we want to hear from you. You can still continue to add your concerns to the question pane. But we want you also to come prepared, because we want to discuss these concerns with the experts. So in session 2, we are going to give you the opportunity to hear from the experts and to have those questions answered. So session 2 is going to take place on Thursday, April the 16th. It's going to be the same time, 7 p.m. Eastern Standard Time. Session 3 will then take place on Tuesday, so this next Tuesday, April the 21st, again the same time, 7 p.m. Eastern Standard Time. And we're going to focus on developing strategies. And with the experts, have that open forum and question and answer. And as Heather had mentioned, you know, we're doing a little bit of due diligence on our side in order to find some links and find some, you know, validated websites that you can go to and that you can, you know, get some of your questions answered, or at least have the ability to ask those questions to those experts as well. Please check your email, because the link for the Zoom meetings for session 2 and 3 will be coming to you in email. So this particular webinar was through webinar GoToMeeting, but we're going to move now to Zoom because we want to hear from you, but we also want to you know, to see you if you feel comfortable doing that. So on Wednesday, you should get your invite to session 2, and on Friday, you will get your invite to session 3. And again, we really do encourage you to join us for these next 2 sessions, because I think this is really going to be the heart of the matter. A special thank you to Janet and Noha, our expert panelists this evening. It's been a jam-packed session, so we didn't get as much opportunity to hear from them, but you will for sure in session 2 and session 3. We know how strapped everyone is. We appreciate your time and the contributions that you've made. And to all of you who joined us, you know, Wounds Canada this evening is our first COVID-19 pandemic Caring for the Carers webinar, but as we can see, potentially we're going to do a lot more because, you know, your input is extremely valuable, and this is what's going to drive us moving forward. I believe, you know, I speak for many of us when I say we greatly appreciate each and every one of you for your care and dedication. And we heard that tonight when people were concerned that, you know, they can't go see their patients. They can't, you know, as Heather said, see them, touch them, smell them. Knowing that you are there for our grandparents, our mothers and fathers and aunts and uncles and friends and neighbors, you know, to hold their hand or be at their side or help them recover, and sometimes support them in their final journey. And you know, it is an emotional time, I'm sure, for many of you, but we do thank you. We thank you greatly. Again, if you do have any other thoughts, you can email them to us anytime. That email address is info@woundscanada.ca. If something wasn't mentioned this evening or wasn't captured, please ensure that you send us an email with that, because we find everything of equal importance. What's coming up? Again, check your email. You will be receiving your Zoom links to the next 2 sessions. And our final thought for the evening, feeling concerned may be normal at this time. And we thank you for sharing and for bringing forward these concerns. In the smallest way and in the largest way, we really do hope that we can make a difference. And together we will turn those concerns into workable solutions, coping mechanisms, resources, and strategies so that you can carry on and go forward. I wish good health to all until we reconnect again on Thursday. Thank you.
Be safe, everyone. Be safe. Bye-bye.